Hello Malaysia, hello world. Apa khabar? Apa khabar? Welcome to another interesting program of our weekly ECM talk with topic for today, health or economy. I'm Rajesh Shahrul, your host. Health is wealth, though it sounds so cliche, has however been scarcely uttered during this coronavirus pandemic. Not surprising, as it has become second nature to individuals, while what have is a public health crisis. Indeed, health and economy are intimately linked and interactive. Contrary to the common view, there is essentially no trade-off between health and the economy. One does not have priority in terms of its nature over the other, but only in timing or order of intervention. Without saying any further, let us hear from my invited guest, who will give us his views and thoughts on this subject matter. I have here with me, via Zoom online call, Yang berbahagia Datuk Dr. Haji Azmin Kas Rosman, Head of Department and Senior Consultant of Neurosurgery of Sungai Buloh Hospital. Apa khabar, Datuk?
Oh, baik. Thank you very much. Alhamdulillah.
Welcome to ECM Talk. May I begin with my first question to you, sir?
Yes, please.
Perhaps, Datuk, you can briefly share with us the current situation now at your hospital, the Hospital Sungai Buloh.
The current situation now. First and foremost, I'd like to mention that I'd like to thank you for this invitation. I'm just a neurosurgeon in the Sungai Buloh Hospital, and not internal medicine physician. Neither am I an epidemiologist, a public health specialist, or an expert in this pandemic. I'm just a staff working in the Hospital Sungai Buloh, and unfortunately, because of this pandemic, we started last year. Most of the departments, except for the internal medicine and obstetrics and gynecology, is only open, and the rest of the departments are just a skeletal crew. So
Right.
The hospital in Sungai Buloh Hospital plus the leprosy center is a fully COVID hospital, and
Right.
we are only treating surgical cases for COVID positive cases, or any disciplines. Where if they have surgical problems or ONG problems, then they will
Right.
be operated in Sungai Buloh Hospital.
So indirectly, Dato, everything is under control, yes?
Yes, it's under control. It's under control. It's slightly better than it was a few weeks ago, before
Right.
the MCO, and
Right.
there is some amount of light at the end of the tunnel, and we hope with the vaccination, which is supposed to come next week, we hope to improve the situation in the whole country. I'm made to understand, like even in countries like Israel, they've already gotten their second dose of Pfizer vaccine.
Very good.
In Germany, they are getting theirs in summer. Some of my friends are getting theirs in summer.
Right.
In Malaysia, in view that we are getting ours end of February, means we are quite fast. I mean, we have to thank the government for getting the vaccine quite fast, and we are getting quite a good vaccine as well.
Alhamdulillah, yes. In your opinion, Dato, which countries by far have protected both health and the economy in the pandemic? And what are the positive takes that Malaysia can learn from those countries?
Yes, I think with the introduction just now, you seem to have answered this question. That you're asking me whether
I know, I'm asking you again.
health or economy. I mean, it goes hand in hand.
Precisely.
There's no trade-off. You have a good health system, you get a good economy. So
Right.
it goes hand in hand.
Right.
You sacrifice health to protect the economy, or sacrifice economy to protect health. There's no such thing. It goes hand in hand together.
Right. Right.
So I think we all have to understand that in the countries which have done really well is, like, for example, in Taiwan, New Zealand, Iceland, Singapore, South Korea. These are the countries which have really done well, actually.
Right.
And I think they have quite a bit of experience, especially for Taiwan. They have
Right.
an experience of SARS quite some time ago in 2003. So
Right.
they've already established a very good system. They have their own task force. They have their own system. Everything is well organized,
Right.
And the thing that all these countries have done really well is that they have a strict border control.
Right.
They implemented a strict border control very early in the stage, as
Right.
early February last year.
Right.
So, and furthermore, they have the geographical advantage, actually, because like Iceland, Singapore, Taiwan, New Zealand, they're all very isolated, actually. Malaysia is so open. We have the seas we have a long sea border, we have a long land border. So
Right.
we have a logistics problem, and
Right.
it's really a nightmare for our immigration and our staff to maintain the borders, actually.
Yes.
So-
I can imagine.
Yes. So I think what they do is they have a quick border control. They quarantine the incoming travelers very fast. They detect the cases very fast. Like in Singapore, they as soon as they have this pandemic, this epidemic, they immediately they do testing on all the migrant workers. So, and unfortunately for us, we have such a huge amount of migrant workers in Malaysia.
Yeah.
And countries like in Singapore, Taiwan, or in Iceland, they don't have such a big population of migrant workers as we do, actually. So we have a bit more disadvantage as compared to them. But relatively, I think we are doing relatively well. But hopefully, we mustn't put our guards down,
Right.
And I think their hygiene, their civic consciousness is very important. Their hygiene promotion is very good. Even long before COVID cases came out, pandemic came out, you see a lot of the Taiwanese people, even the Japanese, they walk around with a mask.
Yeah.
We used to wonder why they walk around with a mask. Malaysians are not used to that. We don't wear a mask at all. Only during the smoke period, when we have the pollution from Indonesia, that we wear the smoke. But otherwise, we don't wear the mask. Otherwise, So it's I think it's the new trend. I mean, not a new trend. I mean, it's a new way of living, is that we have to wear masks and face shield and keep our social distancing every time for ourselves and for our children, actually.
Right.
So the positive points that we have to take from all these countries is one that which actually the Ministry of Health is already practicing, is to strengthen and to have a more dedicated National Public Health Agency to tackle any pandemics, for the present pandemic and in the future pandemics, and we have to have a good plan, which is that we already have. We should have harsher penalties for people who don't adhere to the SOPs, whether it's the customers, the public, or any management. We have to have better border control, ensure policies are to be accepted culturally, socially, and the people have to accept what that we suggest to them. I mean, there's a lot of education that we have to give to the people, and then we have to have proper structures as well, and proper. It would be fantastic that the government is already working on it to have a dedicated hospital for the pandemics.
Right.
For like they have in Turkey or some countries in China, they already have a hospital for all these infectious diseases. A dedicated just for infectious diseases. And then we also have to strengthen in terms of our procurement, which has already been done by the Ministry of Health. And I think that's most of the things that I mentioned has already been done by the Ministry of Health. So we just need to strengthen, because it's the first time that we are facing such a problem, and we all have to be unified in such a problem,
Yes.
and to tackle this common enemy.
Yes.
Okay, Dato', let me go to the second question. Do you think Malaysia has actually showed its capability in balancing between protecting people's health and protecting their economy?
Yes, I certainly believe they have done very well. I mean, we have there's nothing it's there is nothing perfect, you know.
Yeah.
No country. This is still a learning process, you know. We can go back and say, oh, we should have done this, we should have done that, but there is nobody who can say that this is the best route, because it's just trial and error, actually, you know. But we all have to be united in this, and every ministry have to be united, they have the hand in hand. Everybody from within one ministry have to be working together, and everybody have the ministries and other ministries should be working well together as well. Like Ministry of Defense is working well with the police, working well with it. So everything has to be in rhythm to handle this problem. I think it's good that we don't go around bickering about each other and saying that this expert says this expert says that. I mean, we should just help in a way, in a constructive way, to channel our thoughts and ideas. You know, sometimes when we channel things on medias, we get the public can't analyze the information properly, and they have their own interpretation. You know, so I think the government has to be and the public have to be in one voice, actually, in handling this problem. You know,
Right.
We mustn't talk bad or bicker about this whole thing. Actually, nobody knows what's the best solution. But I think, with all due respect, I think they are trying to do what's best as possible. You know, nobody knows what's the exact thing. But I think the Ministry of Health is doing what they think is best for the health and economy to take off. You know.
Right. Well said, Dato'. Well said. My next question. Prioritizing health is prescription for prosperity. What's your say on this?
I think when you did introduction just now, you did say, well, health is wealth. You know.
Sounds very cliche, isn't it, Dato'? Yes.
Yes, but if I ask you a simple question, would you willing to give your eyesight for a house full of gold? If I ask you, if you are willing to trade off your eyesight for a house full of gold, you would definitely say no. I want to have my eyesight.
Right.
In other words, that is not only your eyesight. What more about your whole body, your hearing, your smell, your everything, your life, everything. There's no value you can put to it. You know, you don't know how much it values until this COVID disease affects your own family. Even last night, I had 3 of my friends' who passed away because of COVID.
Oh dear.
The mother-in-law, the friend who was working in UK, and his brother passed away in UK, and another patient also. So it affects them, and when it affects your family directly, then you realize that, my God, this is real, and this is something that we have to work together to handle it. You know, we have to have a strong discipline to enforce ourselves. No wearing mask below the chin. I see unfortunately, a lot of Malaysians have a very leper attitude. You know, we have to be really strict ourselves, for ourselves and for our family and for our parents. You know, that's the most important. Yeah.
Why is that, Dato'? Why is that? Why is this so thing about this leper attitude among our Malaysians? Why is that, Dato'? Can you share with us?
I think it's if you see in education, you look at the Japanese way of system in their school. You know, they're very strict. You know, they're very they started off in the school where they're very strict discipline. You know, very whereas here that I'm not saying that discipline is lacking, but it's maybe it's the weather, or maybe it's just
the way of life, maybe.
Yeah, the way of life. It's by generations. You know, the way we are. You know.
Yeah.
We are living in this tropical country, relatively tropical country. You know, where people can go out and mix around easily, and everybody have quite a big space of their own. Whereas in Japan, everybody is limited with a small space, so you have to be very living in confined space. You have to be very disciplined. wherever you go in your house or everything, the way you throw your rubbish, everything is very, very well disciplined.
Yeah.
Here, people throw rubbish anywhere. They drive the way they feel like doing so, and so I think it's something which the education we should strengthen the discipline of our public actually.
Okay.
And so I think it's important for us to have a healthy nation, because investors are looking at the country, because we want to have the country workers who are strong and healthy, and we have to provide them good accommodation. We have to provide them a good place to stay, a good place to live, and for physically and also psychologically, and so they are able to produce a better output. Unfortunately, if we don't have a good, we don't strengthen this, simple things in life, they're not able to produce good work, and the investors will not be so keen to come to Malaysia. We have to have a healthy country, needs economically strong country, needs a healthy population, a healthy workforce.
Right.
Yeah, and I think we all know that a healthy body keeps a healthy mind. We all have to have a healthy heart, good intentions in your heart, and you have to have a good mind, and then you're able to function yourself very well. So
Here, Dato'. Here.
It's a balance. It's a good balance. We all have to have a good balance in life. We all have to have what we learn in our books, our religious books. We have to have 8 hours of sleep, 8 hours of work, and 8 hours of devotion to your family or devotion to your religion. So we must have balance. We must instill that in our younger generation.
Right. Yeah. Well said, Dato'. Well said. My last question, Dato'. Perhaps you can share with us some of the lessons from the pandemic that we can take to build a healthier future.
Yes, I think this is the first time that we face such a pandemic, and it's so we are learning from this, and we'll never know what happens in the future. The future mutations and everything, and we'll never know how the vaccinations will be to prevent the future mutations. So what we need to do now is we have to anticipate for future problems, future diseases. So like I mentioned, we have to strengthen our border control, have our proper infrastructure for health, proper workforce for health, and to make sure that all the quick detection of all these problems. Like in New Zealand, they have this elimination strategy. Means they quickly lock down everything, get the numbers down, and then they revive the economy back again. So that's what we had done in previously, and I think that was good. And now, but because of the late detection of some of the workers and also the border control, the numbers are getting a bit high. But we hope from the latest MCO that we hope the numbers will come down again, or come down to a plateau. And the lesson that we learned, I personally learned, is that we all know that life is so fragile. Actually, we mustn't take life for granted. The person who died yesterday, he was well apparently on Tuesday. On Tuesday, he said breathing normally, not on just a mild oxygen mask. And today he passed away, just 2 days.
Oh my.
Deteriorated very fast. And a person who, my friend's friend said, this guy just went to buy durian. But unfortunately, the man who sold the durian didn't wear a mask, and he got COVID virus, and he's on stage 4 at the moment. So things like that, it hits you very fast. You have to be completely cautious and careful hours in a day. You must not let mustn't be relaxed at all. Once you go out of the house, you have to be completely careful. You know? Mustn't let your guard down. You know, I
Right.
think we have to do this time. I think all of us have to strengthen our faith. You know,
Yes.
because we'll never know what it hit when it hits us. You know, it's terrible when you are alone in the room or alone in a place. Nobody can see you. You can only see the nurses all in a mask, in the gown, in the shield, face shield. You can't even see their full face, and you alone. You can only. It's a depressing way to go away. You know.
Yeah.
So I think the public has to know that it's a very serious thing, and don't take things too lightly. You know. And and pray to God, and I think it teaches us to be clean, you know, to keep ourselves clean and keep our heart clean, keep the house clean, keep everything clean. You know, we are not very clean in our taking care of our buildings and houses. You know, general public is very. Myself as well. Sometimes I'm not very hygiene. So I think we all have to learn from all this. You know.
Right.
And we have to take care about our diet, actually, our health. You know, the Malaysian people have to take care, eat well. We're not eating very well. We're not exercising. We are smoking. You know, everything, etc., etc. You know, so we must have a more healthy lifestyle. You know,
Right.
so lepak sidang minum teh tarik is not a healthy lifestyle. You know, everybody have to really exercise. You know.
Oh, makan nasi ayam or whatever. Yeah.
So as a nation, I think we should propagate this and propagate a healthy living, a balanced life, and propagate a healthy country. Actually, you know.
Right. Thank you, Dr. Haji Azmin, for sharing your thoughts on the subject.
Welcome.
Malaysia continuously improving its social infrastructure and health system capacity had been adequately fixed at an early stage and general quarantine imposed. With these, the quarantine could gradually be eased, making sure that the safeguards and protocols continues to be strictly followed. Not an impossibility, Malaysia, together with its other Asian neighbors, were able to do it and have since been in better shape, health and economy-wise. Thank you once again, Dr. Haji Azmin, for taking your time from your busy schedule to be with us in ECM Talk today. Please don't forget to like, share and subscribe to Edu Channel Malaysia. Until we meet again in our next program, take care and stay safe everyone. God Almighty jaga kita. Jumpa lagi. Bye.